Okay, here we go. Welcome to our third spring webinar in our ongoing Finger Lakes Forecast series. I'm Gay Nicholson. I'm the president of Sustainable Finger Lakes, and I'm really glad to have you all join us today as we're going to be exploring how changing climate conditions will bring new health challenges from extreme weather events to more subtle shifts in the spread of disease. Our organization has been working since 2004 on the many challenges we face as our planet heats up, and we scramble to find ways to slow it down while coping with so many interwoven impacts that are already hitting home. We've hosted climate-themed regional conferences and workshops and rallies and teach-ins over the years, and our Finger Lakes Climate Fund is probably the oldest carbon offset fund in the country and pretty unique in that the offsets go out in grants to help lower income households pay for energy efficiency upgrades. Our Finger Lakes Forecast webinar series that you're here for today has been continuing this work by offering a place where we can learn together about the many diverse ways climate change is going to impact our lives, our environment, and our regional economy. Our webinars are at noon on the second Wednesday of the month, but if you can't join us then, you can just register for our webinars and we'll send you a link to the recording. So with us today are four people with substantial knowledge about the ways that climate change is increasing health risks over a really wide spectrum of impacts. First, we're going to hear from Dr. Neil Muscatiello, the director of the Bureau of Environmental and Occupational Epidemiology in the Center for Environmental Health at the New York State Department of Health in Albany. He's the principal investigator on the CDC-funded Climate Ready States and Cities Initiative grant, which supports climate and health adaptation projects, especially for our most vulnerable communities. Then Bryon Backenson, the director of the Bureau of Communicable Disease Control in the Division of epidemiology at the New York State Department of Health, is going to share the department's investigation of communicable disease outbreaks in New York and how vector-borne diseases are spreading as our climate warms. And then next, we're going to shift our focus to the local level of communities. Dr. Danielle Eiseman is the Associate Director of Cornell's Health Impacts Core in the Department of Public and Ecosystem Health. She's a communications expert who specializes in helping communities design and implement interventions to promote resilience and health equity. In her current role, Danielle focuses on the impacts of climate change, specifically extreme heat, flooding, food security, and vector-borne diseases, as well as the actions required to address these issues. Our last panelist is Douglas Barnes, who will share what we're doing at the local level. Doug is a senior environmental health specialist for Tompkins County Whole Health. He oversees several programs within the Environmental Health Division, such as the education efforts on tick-borne disease, and he's heavily involved in the division's collaborative efforts in the protection of source water in Tompkins County and reduction of nutrient loading to the local water bodies in response to the increased frequency of harmful algae blooms. Now we're going to save questions until the end, but feel free to use the Q&A button to submit your questions to the panelists, and we'll dig into those at the end. So, okay, let's go ahead and get started. Neil.
Great. Thank you, Gay. And good afternoon, everyone. I'm going to share my slides here. Can everyone see a slide view?
Now, yes.
Okay, great. Well, thanks for having me on today to talk a little bit about climate change and health and how we're thinking about climate change's impacts on health. As I jump into the presentation here, see if we'll advance. I just wanted to mention a lot of the work that I'll be talking about today is not only supported by staff funded by the state, but also by grants that we've received over the years from CDC and NYSERDA, which has really helped to advance our work in this area. So some of you may be aware that the state a couple of years ago published a climate impacts assessment, which was an update to a previous report, sort of providing a state of the science summary on how we think climate change is going to be or is already impacting New York. And without getting to all the details on the slide here. The conclusions were essentially that, as many of you probably know or are feeling, New York State's gotten warmer and is projected to get warmer through the end of the century. It's gotten wetter and is projected to get wetter through the end of the century. Compared to a reference period going back to the mid 90s or so, the tropical storms and hurricanes that we've experienced, it coming off the Atlantic Ocean have tended to be a little stronger. And while we don't necessarily know that the number is going to increase in the future, it seems like they'll project to be stronger and perhaps shift farther north. And then in terms of wildfires, while it's not expected that we sort of end up in the same experience that we're seeing in the western states with those huge wildfires, as we know, the last few years we've been impacted by the smoke from those fires and fires in Canada coming across the US or coming south and impacting our air quality. So in terms of visualizing sort of what the extreme heat projections mean, essentially across all areas of the state, we'll be experiencing more 90-degree days. And for a city like Canton and its temperature profile now, or back in a reference period going back to 80 through 2010, by the 2080s, under a very high emission scenario, it may feel more like someplace in the northern Appalachian region of the country. So that's quite a significant change that we're thinking about. And then again, just visualizing sort of what the projected precipitation changes mean. It's not limited necessarily to one part of the state, but expected to be widespread. So from a DOH perspective, Department of Health perspective, we ask, how is this going to be impacting our health? Any new sort of or changing exposures that we're seeing? How is that impacting our health? And, it's not just the direct impacts of temperature getting hotter and perhaps having heat-related illnesses or, more extreme weather leading to more injuries and fatalities from flooding or that sort of thing. But it's also the heat changing the chemistry of the air and changing the air pollutants in the air, or as I mentioned earlier, wildfires bringing particulate matter into our state and impacting air quality that way. It's also, warming, creating a more suitable range for the life of certain vectors that can impact us, lengthening of allergy seasons, right? Changing water quality impacts and food supply and water supply impacts. And then, on a sort of different level, the environmental degradation that can lead to migration and civil conflict, that sort of thing. So the point is, aside from these direct climate change impacts that I mentioned, warmer weather, wetter weather, it's also, sort of those impacts that it has on other environmental conditions and the associated health impacts we see there. So I also like to think about, climate change as a sort of a stressor that contributes to or adds to like our existing stressors, right? It's not, as I mentioned earlier, necessarily a linear impact in the sense of climate change influencing these exposures to health outcomes, but it's also, increasing risks for older adults who may be more susceptible to the impacts of heat. It's different risks for people who live in a spot where perhaps through disinvestment or other policies don't have access to green space or live in an urban heat island where sort of those impacts of heat are magnified. But also, thinking about places like where we're developing into areas that used to be forest lands, and that's sort of bringing us more in contact with those vectors that can cause disease, on top of the fact that maybe now their habitats are more ideal for survival. And Bryon can correct me on if I'm sort of saying that right. But the point is that context matters here. Like a healthy young adult who works in an air-conditioned office and drives home in an air-conditioned car to an air-conditioned home is not going to have the same risk as an older adult who works outside all day. And a person with asthma who has the resources to manage air condition and can filter air during a wildfire isn't going to have the same risk as someone who doesn't have access to the primary care physician and for example, can't filter their air at home for whatever reason. So, I think in public health generally, we think of health as being multifactorial, and climate change is sort of an additional stressor on top of all this. So in the upcoming slides, I'm going to talk a little bit more about the work we've done specific to extreme heat and wildfires, and then I'll provide a list of some informational resources that we've put together that could be helpful to you all. As you're thinking about climate change and how you can play a role in sort of this effort we're involved in to adapt to sort of the impacts that are already baked into the system. And then I'll talk a little bit about work we've done to support local efforts towards climate and health adaptation as well. So, we were lucky enough several years back to get some funding from NASA to look at how temperature is impacting health in New York State. And, we have access to a database that provides a record of ED visits in the state. And so we were able to link that with this temperature data from NASA, which was a remote sensing data product that we had, and look at what are the connections between heat and health. And I think what you can see on this slide is that as our heat index, is sort of like real field temperature, if you will, increases, we don't see the same changes, but we see increasing risks across both diseases that are directly related to heat, like heat stress and dehydration, but also health outcomes that are less directly related, like acute kidney failure and cardiovascular disease. So this was really useful data to have, and ultimately led to some work to change the threshold at which National Weather Service issues heat advisories in New York State. Another interesting finding from this work was that, these risks for heat-related illnesses are broadly the same across all parts of New York State. So we do think about, I mentioned earlier, urban heat islands, and, that's a real thing. But, the risks per increasing unit of temperature is fairly similar for New York City, other urban areas in New York State, and rural areas. And while those contextual factors may be different in those places, I think it just sort of serves to remind us that we need to be thinking about, how we create messages for all residents in the state. It's not just one type of, it's not an urban rural difference that we're seeing here. So we've also tried to look a little bit more in depth in whether or not health risks vary by month and by certain demographic factors. We in some of our data and other studies that have been done, sort of show that there's some acclimatization that occurs during the year, during the warm months. And while we saw some higher risks in May, compared to other months, it wasn't like super clear that it was only that acclimatization. In fact, as you can see in the slide here, while there's some changes in risk across months, there's broadly sort of similar results across months of the season, but we're still thinking about how we may be able to tease out acclimatization effects in the data a little bit more in the future. Age, again, all age groups are at some risk, but we saw pretty clear gradient from young to old with higher risk with increasing age in the data. Trying to understand the urban rural results a little bit more. We also looked at sort of demographic factors by urbanicity. And the one that really stood out to us was that while many sort of stratifications of urbanicity among different race groups. We saw the biggest difference among non-Hispanic Blacks, and we're trying to understand that a little bit more with the work we're going to be doing in the future as well. It could have to do with a number of different factors that we don't have necessarily specific data for in the data sets we have available to us yet. I think is a finding that we're interested to think more about in the future. But the main take home from these slides is that we see these heat health risks in different groups, and but that they apply to different health outcomes as well. And so taking these results, we've sort of then thought about, well, what can we do to help reduce those risks? And so one thing we've done is create extreme heat web resources. And I'm not going to get into detail and too much on this because I know I'm limited on time, but I provided a web page at the bottom of this slide where you can go and find heat web resources that increase just simple messages on what you can do to reduce risks. There's some that are tailored to particular groups. We've also created a heat risk and illness dashboard, which actually pulls a tool that was developed by CDC and National Weather Service called the Heat Risk Tool into a display that also includes real-time information on heat-related illness from our syndromic surveillance data set, which is a record of ED visits, as well as EMS calls throughout the year. We do a lot of work with partners, and particularly highlighted in this slide is promoting access to cooling. So the Office of Temporary Disability Assistance and the New York State of Health, which runs the state health insurance marketplace, both have programs where qualifying individuals can get access to a window air conditioning unit. And, we recognize that this has some role in contributing to additional greenhouse gases, but we think of it as a health equity issue. We see disparities in access to air conditioning by income and race. And, I think it would be, we certainly want to, as technologies develop, but there's a better alternative than what we currently have that releases less greenhouse gas emissions and can be adapted for a program like this. That would be great. But for the time being, we think it's important that folks have access to a cool space in their homes. For those who still don't, we work with local health departments and emergency managers to map cooling centers, which are places where people can get cool in the summer if they don't have access to a cool spot in their home. It's a voluntary sort of program, and nobody has to report this information to the state, but we've had a lot of interest in it, and we had over 800 cooling center locations reported by 51 of the counties in the state last year. So really excited about that. I'm not going to focus on resources here too much, but I'll provide these to Gay after the presentation. And I'm happy to answer any questions, follow-up questions that you might have after you've had a chance to look at them. I'll provide my email at the end of the slides as well. So in terms of wildfires, again, this was not necessarily something that was on the top of the radar going back a few years, but I think the events of 2023 changed our thinking on that. And even since that time, we've had some wildfire impacts, but even if they haven't been quite as severe. So going back to those 2023 dates, it was an unfortunate opportunity to look at health impacts. And again, using this syndromic surveillance data that provides us with a snapshot of what we're seeing in emergency departments. We started across the state in different regions, did see what looked to be a spike in asthma related symptoms on those days when the air quality was at its worst during those events. I will point out an interesting finding is not interesting, but again, context matters here, is that while, these June dates, we did see a spike in asthma, it was less clear when looking at acute respiratory conditions as a broad group, and a lot of those are infectious, so that makes sense. But again, compared to other Junes in recent years, that spike, particularly in the asthma symptoms, was notable. So, coming out of those, we're developing protocols for some enhanced surveillance and communication to our partners during air quality alerts. And we're actually doing some research now to better understand those health impacts from wildfire smoke in more detail. And then again, here's some links to some resources that you might find useful in your own day-to-day living about how to sort of respond to a wildfire event. And then the Clean Air Center is sort of a newer initiative we're working on to provide some guidance for locations, primarily those who want to open up as cooling centers, but to allow them to sort of be also a place that might provide cleaner air during an air quality event. So just again, I'm going to quickly kind of run through some efforts to prepare for climate change and how we've been supporting those at a local level. We've had a good partnership with NICE HO over the last 5 years or so in conducting some work groups with our local health departments and some of their partners. And we're starting in our fourth year providing some technical assistance mini grants. And Doug at Tompkins County is going to talk a little bit about the work they're doing, which utilizes in part some of those funds. Last year, we had a performance incentive program that was themed around climate change or extreme weather. And that's a program that the state DOH implements each year around different topics, and essentially successful completion of a number of tracking measures in the program opens up to funds that can be used for core public health work. And we were happy that 47 of our 58 counties successfully completed the program. So we were really happy with that. And then the other program I'll mention is the Department of Environmental Conservation's Climate Smart Communities program, which helps local governments take action to reduce greenhouse gas emissions and adapt to a changing climate. So there's actually a process where taking concrete actions to lead to becoming a certified climate smart community. And it also opens up the door to some additional grants which can support some of that work. So that's a program where we've tried to, plug in and encouraging in the development and implementation of certification actions related to public health. So I think I'm getting close to my time here. So I'm going to basically the last couple of slides here, we're just highlighting some mini grant examples, and you can look at those and you can go to the link that I provided on this slide to see more about previous years and what the mini grants were. And then again, the performance incentive program I was going to talk about in a little bit more detail, but I think in the interest of time, I'm going to move through this, highlight some additional resources that may be of interest to you all. And then just thank you for your time and hand it over to Bryon.
Right. As I pull up my slides, one of the things that I wanted to mention here is that, on one of Neil's, there we go. Share. Well, I'm going to talk mostly about vector-borne disease today. One of Neil's slides, the one with the spinny wheel there in the middle, is one that showed a lot of potential impacts from that showed a lot of that showed a lot of other diseases in there, and mentioned some of the things that we wind up dealing with in my shop that does communicable disease control and deals with outbreaks. One of the ones that doesn't get as much press, but is something that we're seeing more and more often is increases in vibriosis. It's cholera, but there are other diseases that are also caused by different species, and that typically comes from warm waters and shellfish. And as we see Long Island Sound and the areas on the Atlantic side of Long Island as well, as we see those waters getting warmer and warmer, we've seen increases in numbers of vibriosis cases year over year. So again, it's one of those things where there's a number of things that climate is potentially involved with. In some cases, it's really quite obvious. In some cases, it's a little bit more subtle. And one of the things that people typically think about as being most obvious are vector-borne diseases. So diseases carried by ticks, diseases carried by mosquitoes, and people justifiably and truthfully realize that an extra degree here or extra half a degree there can expand the range of a particular mosquito or tick species. It also can help them live longer into the fall and start up earlier in the spring. So let's talk a little bit about that now. Okay, so our basic approach here at the State Health Department, and we've been doing this we started working with ticks and mosquitoes in the late 60s, so we've been doing it for a really, really long time, is to basically do a couple of different things. Is to one, use human disease surveillance. There's a number of different diseases out there that have to get reported to us, so we get good information about those. It's also then to work on tick and pathogen surveillance. So one of the things that we do is we go out, we collect ticks from across the state. At one point in time, we had people send us ticks. We did that for just about 20 years or so. It was sort of crowdfunding before crowdfunding was a thing. And they would give us an opportunity for us to learn where ticks were across the state by people giving submissions to us. Um, but we have since sort of stopped that, and now we go out and do our own tick collections. It's a little bit more scientific, and you'll hear about that shortly. But what we learned from hearing about human cases and what we see about collecting ticks and then testing those ticks for certain pathogens helps us target certain things for prevention and education and control of tick-borne disease. And I could also say mosquito-borne disease for this as well. So when we're talking about ticks, some people may not realize that there's two different main kinds. There's soft ticks here on the left and hard ticks on the right. We don't necessarily have many soft ticks in New York, but we do have some. They act completely different than the hard ticks do. Soft ticks are a great big problem in other parts of the world than in other parts of the United States. But for us, it's these Ixotidae, these hard ticks, that are the ones that are of most concern to us and what most people are familiar with. The one you see here on the screen is one that you see here as well. It's the black-legged tick, sometimes now called the deer tick as well. And there are about 30 different species of ticks found in the New York State. About 10 of those will commonly bite people. And then there's 4 species that can potentially transmit diseases here in New York. That black-legged tick or deer tick I mentioned earlier, at one point in time, this particular tick was sort of split genetically into 2 groups. And we called one the black-legged tick and we called one the deer tick. Subsequently, those groups have sort of been put back together again, and they've gone back to the black-legged tick name. So the deer tick name isn't really official anymore, but you will still hear people wind up using it. This is probably the most common tick that we see in New York, particularly in the Finger Lakes. But there are others as well. The American dog tick is a much, much larger tick, probably 2 to 3 times as large as the black-legged tick is. This can carry Rocky Mountain spotted fever. The Lone Star tick is one that you may see in the news for something about a meat allergy called alpha-gal, but it carries some other things as well. But this is really way, way more common on Long Island. We've seen sporadic instances of it in upstate in the Finger Lakes, but never a substantial population, and never certainly a population the size of what it is they have out in Suffolk County at the end of Long Island. The woodchuck tick can also carry Powassan disease. And the woodchuck tick and the deer tick or black-legged tick are really, really close um, in terms of identifying them. They're actually much, much closer to identical than what this picture shows. People don't usually come across woodchuck ticks too often. When we go out and we try and collect them, they really are associated mainly with woodchuck burrows and holes. And for us to go find them, we almost take a giant Q-tip and go inside their holes to try and find them. So again, most people aren't going to typically come across woodchuck ticks, but they can transmit illness to people. Every single tick has a kind of pattern in terms of when it is out. There's 3 different life stages of ticks. There's the adult stage, the nymphal stage, and the larval stage. Or if you want to kind of go the opposite direction, they hatch from an egg into a larva. The larva turns into a nymph. Nymph takes a blood meal and turns into an adult. Ticks are not necessarily like butterflies where they wind up going through their entire life cycle in up to a couple of weeks. Ticks can go through this entire process over a 2-year period, which means that certain life stages are active for certain periods of time. The black-legged tick, like we talked about earlier, its larval stages are active in midsummer, typically in August and September. its nymphal stages are usually active from May through July or so. Though climate change is helping stretch some of these things out. And then the adult stages usually start, we usually see them at the beginning of October, and then they'll make it through the winter, and we'll usually see them, peak out in late May or so before they tend to give way to the nymphal ticks. And you can do the same exact sort of map with the American dog tick, with the Lone Star tick, with the woodchuck tick as well. But one of the things that's happening, I think, due to climate change is some of the kind of traditional life stage patterns for these are starting to get a little bit messed up. Some are stretching longer. Some are, in some cases, you're finding nymphs when you would expect to find adults. Um, and we really do think that this is sort of related to what we see with regards to climate change. Obviously, these ticks that carry illness, knowing kind of when they're out there and if they're out there at different times, it changes the risk profile for being exposed to certain illnesses. We go out and we collect ticks across the state. We've done it since 2008. Like I said a little bit earlier, prior to that, we had a system where people could send us ticks for what they thought was a tick, and it would come to us, and we would identify it, kind of give them a ballpark idea of how long it had been fed and what potential diseases that species of tick can carry. We never tested them for cost reasons and some liability reasons probably as well. But we would kind of provide information about what it was that they had found on them or their dog and what they submitted to us. Again, we stopped doing that, and now we go out and we actually go and collect ticks ourselves, and we go across the state. We go and flag and drag for ticks depending on the time of year. We go to a lot of locations every single year. Some we go every other year, every third year. We usually try and collect at least 50 ticks at each location. We collected over 100,000 ticks in the past 15 years or so. And we've tested over 205,000 ticks for viral agents as well. We usually have two different types of tests: one detect for bacterial and parasitic agents, and one detect for viral agents. And we share that information with county health departments, some other state agencies, medical providers, veterinarians, and the public. There is a website out there that shows by county what we've collected and what the infection rates were for those particular ticks. These are all the dots where we have been since 2015 through 2024. And in some cases, the dots are piled one on top of the other. So it may not be completely representative or show as well as it could kind of where we have been. And we do this in the spring and in the fall. So we're out collecting now, and we'll go out probably until mid-July. And then we'll go and go through a whole period of testing those ticks that we collect October into Thanksgiving or so. And then throughout the winter, we'll test those ticks that we had collected then. But in 2024, for example, we went to little less than 250 locations, 48 out of 57 counties, collected almost 34,000 ticks, and went through and tested a number of those. The infection rates do vary by tick life stage, by pathogen, and by location. So the ones that are most likely to be infected are adult black-legged ticks or the pathogen that causes Lyme disease. In some cases, we can see up to 60 or 70% of those being infected with that particular bacteria. Some other ones, it could be less than 1%, for example. So, some of the information we wind up putting out there kind of helps guide risk. It's difficult information to convey. We don't want to say this area is more ticky than another, or that area is more likely to have an infected tick than another, because in general, it really only takes one tick to bite you in order to be able to transmit one of these particular diseases. And we want to make sure that, there are places that have a higher risk, but everywhere has at least some level of risk. So the diseases that we have, and this is me, if you work with ticks at all, eventually you wind up getting bit. So we take pictures. And this is tick-borne diseases in the United States from 2019 to 2022. This is a really good paper, this one by Lars Eisen from Ticks and Tick-Borne Diseases. It was just recently published, and it really goes through kind of the state of where ticks are and how to prevent what we can do to try and prevent tick bites. And we'll talk a little bit about that later on. Again, all the assorted different dots on here make it a little difficult to sort of see what's going on, but you can see that all these down here, in the legend, these 8 different pathogens, they cover these pathogens you can find in an awful lot of places. Lyme disease is sort of the teal, and you can sort of see that across the upper Midwest and across the Northeast. Um, this purple here is anaplasmosis, and anaplasmosis is sort of the highest rising or the fastest rising tick-borne disease that we've seen in recent years, and it continues to sort of rise as well. The good thing about doing what we do with ticks is we can compare what it is we see with ticks to what it is we see in people, and they match really, really nicely, which is good. It basically shows that when we see risk of getting bitten by a tick in a certain area, those are areas where we're actually seeing human cases of it as well. They validate sort of one another. We have used them in the past. One of the first things we did when we started going out to collect ticks, it was triggered by the fact that we saw babesiosis cases in an area where we'd never seen them before. And we basically had said, hey, let's go out and collect some ticks and see if we can find babesiosis in them. And when we did that, we found babesiosis, but we also found anaplasmosis at the time. And anaplasmosis at the time wasn't a disease that doctors were on the lookout for. So again, it was one of those things where we use that information to then relay that back to providers and sort of say, hey, this is a disease you should be on the lookout for as well. This is the symptoms you need to look for. This is how to test for it, and so forth and so on. So this is a static picture from 2019 to 2022. But if you look across the United States, I could show you similar ones for New York, but I think the national one is actually a little bit more impressive. 1995, Lyme disease was sort of limited to certain areas in the Northeast and the upper Midwest. In 2010, you can see it expanding. And 2023, you can see it basically covers practically the entirety of the Northeast. It's starting to creep south, and it's obviously enlarging in the upper Midwest as well. Some of this is a function of changing Lyme disease case definitions. But you can't have a positive case unless you have positive individuals. So again, it clearly shows that the areas where you can encounter Lyme disease are definitely spreading. And I've been doing this for 35-ish or so years. And when I first started, seeing a black-legged tick in Rochester or Buffalo was an impossibility, and therefore seeing Lyme disease out there was an impossibility. That's not the case any longer. Just to give you an idea of numbers, for example, Lyme disease between 2001 and 2023, so this roughly 23-year period, 153,000 cases, anaplasmosis about 13,000 cases, babesiosis about 9,000 cases, monocytic ehrlichiosis 1,800, Rocky Mountain spotted fever 450 or so, Powassan encephalitis about 50, tick-borne relapsing fever 10, tularemia 35, and there's some other newer ones that we're starting to wind up seeing, that alpha-gal meat allergy, which I mentioned. There's these wonderfully named Heartland and Bourbon viruses, and we're starting to see some other things as well. This little highlight here showing what they are, whether they're bacteria, a virus, or a parasite, just again shows that ticks are pretty magnificent little animals in the sense that they're able to transmit a number of different classes of things. And again, it makes them a little bit interesting to work with, but also a little bit tricky that they can carry so many. And these diseases, these 5 that are marked by this black-legged tick, you can, they're all carried by the exact same species of tick. There are challenges, and we said we'd talk about climate. So one of the things that we've seen as we go through, we can basically see that ticks in New York State have had a long history. Back pre-1900s, the Native Americans out at the end of Long Island talked about this thing we call Montauk-knee. We expect that is Lyme disease. Symptoms match up sort of completely, and we know that that's an area where Lyme disease has had a foothold for a really long time. In the early 1970s, when we first started, our main work was on Rocky Mountain spotted fever, ehrlichiosis, and babesiosis. Lyme disease, people sometimes forget, is relatively new in the grand scheme of being recognized. And in 1979, it was first recognized in people. And then in 1983, us in New York were the ones who actually described the pathogen for the first time, seen in some collections from the end of Long Island as well. We talked about our tick ID service. Some of the diseases split into a couple of different diseases as they wound up going through more genetic analysis, and micro and molecular biology got better. We had our first Powassan case. We started active tick surveillance. We've seen different tick species now start to show up in 2018. Different diseases show up in 2018 and 2019, and then other Borrelia and Babesia species have shown up since. the short answer is we're going to see more and more ticks and tick-borne diseases as time goes on. Some of this, again, is a function of better micromolecular biology to identify some of these things. But the fact is they're there and they're still making people sick. So the number of tick-borne disease cases has more than doubled from 2014 to 2016. Like I said, 7 new pathogens described, and case numbers keep going up and up and up. Um, why? So why are they going up and up? Expansion of areas where ticks are found. Some of this may be climate. A lot of it probably is. There are more pathogens. There's more people at risk, travelers, development, recreation. 20 years ago, you wouldn't see a kayak on the roof of a car, and the hiking trails for a lot of our parks were not as well trod as they are now. Now you go to places and you can't find a parking spot at a trailhead, and you see a kayak on the roof of every car. More people are out, which is good. It's great, but it also means that more people are potentially at risk as well. The micromolecular testing advancements I mentioned, and then there's weather, environment, and climate as well. Climate and weather impacts ticks in a bunch of different ways. The individual seasons are longer. Ticks can emerge earlier in spring and go into their kind of pause period later in the autumn. Those season length changes have changed tick seasons in some cases, like I mentioned earlier, that overlap or flipping of life stages. Our milder winters tend to allow greater tick survival. Hosts and other food sources. It's not just ticks, it's what the ticks feed on as well, and changes in them can certainly impact the number of ticks that are present. It's not completely straightforward. There's a lot of people who talk about, with climate change, we're going to see Lyme disease at the North Pole. And while that may sort of be the case, right, it's not completely the case. Some conditions are better for some ticks than others. And for example, on Long Island, we're seeing 2 new ticks go in, the Lone Star tick and the Asian longhorn tick. And in those areas, they seem to be doing better than the deer ticks are, or the black-legged ticks are. And so in some cases, we're actually seeing the number of black-legged ticks on Long Island start to go down. Um, but these other diseases go up. So these other ticks and the diseases they carry go up. So in general, you run into these issues where we don't 100% know exactly how climate change is going to impact specific diseases and risk, but we know that there definitely will be expansions and different ranges, and we will see more and more tick-borne disease as time goes on. We talk about all our layers of protection, about clothing, and then repellents, and then the assorted behaviors. A lot of the messages that you've all seen and heard before over the years about protecting yourself against ticks. All these are individual behaviors. And the problem that we have compared to like mosquitoes is there's no real cost-effective area-wide tick or host control. There's a lot of things that have been talked about. Um, Tick vaccines and spreading, kibble and food out there for mice to feed on to vaccinate themselves, all of which works in small areas, but they don't work in big global areas. It's not like you could, drop this stuff over the entirety of the finger to be able to do. There's also no vaccines quite yet. There is potentially a Lyme disease vaccine that'll come shortly, but the Lyme disease vaccine that will come shortly is only for Lyme disease. So you would still have to do all the other Swiss cheese things on this particular slide to protect yourself against babesiosis and anaplasmosis. And to be honest, we might even see those diseases go up among people who would be vaccinated because they may stop doing some of these things because they think they're protected. It's one of the things I think I worry a little bit about with regards to vaccines for some of these things. Our biggest challenge is always going to be just how big these ticks are. So this is an infildeer tick. This is my arm. This is the inside of my elbow. This is the palm of my hand. And just seeing how little these ticks are. These are the ticks that are starting to come out now. These are the ones that transmit the vast majority of Lyme disease. And they're just so small that you don't see them and you don't pull them off in time. And so the combination of longer ranges, larger geographic ranges, longer seasons, and a tick this small is going to lead to increase of disease, sort of no matter how we put it. This is how folks can get a hold of me if you ever want. Again, the slides will be posted at somewhere, and I will pass it on to Danielle.
Okay, thank you, Bryon. I now just realized that I may have had a nymph tick on me last week, thanks to your photo. Um, So, good afternoon, everyone. I'm Danielle Eiseman, and I'm the Associate Director of the Cornell Health Impacts Corps. And I'm here today to give you more of the community engagement side of these issues. Um, go. Just to give you some background on what the Cornell Health Impacts Corps is, we're a relatively newer program within Cornell Public Health. We're about a year and a half to 2 years old, but we really focus on working with community members and community organizations as well as government partners to develop interventions and solutions that meet the needs of communities, especially when it comes to the intersection of climate change and health. We also try to leverage the resources that we have at the university and in our department to, again, provide some additional expertise when trying to meet the needs of communities and community organizations, as well as our state and local and federal partners. Um, I'm not going to spend too much time on the intersection of climate and health because Neil had done so already. Um, so just looking again at what we focus on from the perspective of the Cornell Health Impact Score, looking at how increases in atmospheric greenhouse gases lead to increases or changes in either temperature and precipitation, and we can see that that leads to changes in air quality, extreme weather events, water quality and quantity, as well as ecosystem changes, which then expose us to different pathways for different health outcomes. Um, and again, I'm not going to go into this too much because it's already been covered. But from the work that we do, we've recognized that these impacts don't happen in isolation, and that there is a lot of compounding events that reinforce or strengthen the impacts that we are starting to experience as they are driven by changes in climate, whether it's changes in temperature or changes in precipitation. Um, And as we look at the forces that are shaping the field, kind of building from that interaction between climate and health, we're starting to see that a higher percentage of adults are experiencing more frequent extreme weather events. Just in the past 5 years, adults have experienced at least one extreme weather event. We've seen this compounding of catastrophic events, such as wildfires, that lead to hazardous air quality issues for millions of people across the United States. We're also seeing a greater strain on our disaster response and emergency response systems. And again, Neil covered the aspect of extreme heat, but we've seen that from national surveillance estimates that between the years of 2018 and 2022, the average number of residents that visited emergency departments each year was roughly 65,000, and we've seen a doubling of that across the United States. In multiple regions, and this is a trend that is continuing as we continue to experience record-breaking temperatures across the United States. But bringing it back to kind of what we're experiencing locally, this was a question on a survey that we had run about 2 years ago now, where we asked people working in public health and emergency management across New York State what they're most concerned about when it comes to weather-related emergencies. And while people mostly listed that, snow and ice and flooding, they feel pretty confident responding to, some of these other types of events that we're starting to experience more frequently, they're less prepared for that, such as wildfire smoke, extreme heat, wind events. So those were a top concern. But in one of the open text responses, one of the respondents had indicated that any event that limits access to those impacted by whatever type of event it is a challenge, especially weather events, or loss of communication and utility events. So this is a paper that has just been accepted by the Journal of Emergency Management, so that should be out relatively soon, and it will be open access, so there's no paywall to try and get around. But again, thinking about how often that happens, this was a report that was put out by the Department of Public Service in New York State last June. And we get back to that point mentioned in our survey, that any type of event that disrupts communication or power access, and we've seen a significant rise in the number of extreme weather events that disrupt power. So this quote from that report from the New York State Department of Public Service indicates the state has experienced 42 separate storm events that qualified as major storms in 2024, 15 more events that then had occurred in 2023, and we're seeing a significant impact or a significant increase in the number of people that are affected by major storms, with 109% increase and customer hour interruption due to major storms. And so we're starting to see that disruption and loss of power, which for anybody who is reliant on medical equipment and requires electricity, or people who require refrigeration for medication, this poses a particular threat to those individuals. And we're starting to see more and more frequently that NYSEG is coming out and distributing bottled water and dry ice to try and fill those gaps, as it takes longer to provide repairs for electricity and power generation. And these impacts, again, beyond the aspects of health, have a long-lasting effect on our communities. And so these are some economic perspective research papers that have come out over the last decade, showing that while we do have some of the immediate health effects that are a concern, there's also a longer lasting impact that these types of events are placing on our communities, that we should also be considering as we're trying to address how do we develop interventions that protect health and safety of the people in our communities. And so we've seen from the data collected here that extreme storms can slow economic growth for up to 2 decades. Every weekday over 86 degrees can cost the average US county $20 per person in lost productivity. That might be even higher now because that paper's from 2014. And then beyond the immediate impacts from hurricanes and storms, that recovery can lead to these longer term poor health outcomes as well as early mortality. And that can be attributed to economic hardship, stress, loss of social networks, and reduction in resources and services. And so this really kind of creates some significant challenges for us if we look at this or these problems from a systems perspective. On top of that, we also have some perception gaps. So when it comes to flooding, which is one of the topics that I tend to work on, that there's a significant gap in public perceptions about how the level of risk that they are faced with when it comes to flooding. So, this was a smaller survey, and the data came out earlier this year but 57% of, the amount of people that responded to the survey was 133, but those individuals living in floodplains perceived their flood risk to be significantly lower than what the FEMA flood maps were estimating. And if you haven't personally experienced flooding, then you tend to have a lower perceived risk to be at risk of floods. And then people tend to fill their understanding of floods and flood risk by drawing comparisons to other types of hazards, such as hurricanes, and that can lead to inaccurate assumptions. And that really connects well to what Bryon had mentioned in terms of that Swiss cheese model of kind of not if we have that vaccine for Lyme disease, then we may not be taking those other steps of protection for other types of risk. And then there's large gaps in understanding of just how dangerous flooding is. 6 inches of water can knock an adult human being down, and that can lead to drowning. So we have these challenges when we're trying to address public health and public health interventions at the community level. Additionally, again, connecting back to what Neil had mentioned before, that we are experiencing more frequent extreme heat events, yet there's this perception gap when it comes to how individuals perceive themselves to be at risk for extreme heat. And even though we have the data to show us the heat risk and heat vulnerability, there's this perception gap that individuals don't necessarily feel as though they may be at risk for extreme heat. So, given all of these challenges, what are we doing? So CHIC is Cornell Health Impact Score to engage the community at the intersection of climate and health. And so I'm just going to give you a quick snapshot of some of the projects that we've been working on to try and get more community engagement with these issues and really develop and co-design approaches that help the community take more protective actions when it comes to all of these risks. One project is the Hard Rain's Gonna Fall project, which used storytelling events that were held throughout Tompkins County to capture people's experiences with flooding. And we've been comparing that to the county hazard mitigation plan that focuses on flooding. And within that project, in addition to the storytelling events, we've also developed a community storytelling guide. So other organizations can replicate what we did. It includes the assets, such as the promotional assets. It includes a magnet that people can put up on their refrigerator to help them prepare for floods. And then I've also created extreme weather scenario planning cards. So we've been able to develop extreme heat cards, flood cards, and food system cards to help drive community discussions on what are the potential things that could occur during these types of events and how prepared are we, or what concerns are we not thinking about when it comes to responding to or experiencing these types of events. And the results of the stories that we've collected throughout Tompkins County, what we found is that flood management is an ongoing challenge within our community. Anybody living in Tompkins County, this might resonate with you. I know I experience some water challenges every time we get a heavy rainfall. And we found that personal stories really highlight the shared experience across our community. That, although we might live in different spots across the county and at different levels in terms of height, some are uphill, some are downhill, but still we have these shared experiences. And that within rural communities, that there's this self-reliance and adaptability that starts to come out. So a lot of people discussed some of the hacks or different things that they've tried to respond to flooding, and that we have some infrastructure and communication failure, as well as a strong desire to connect within the community. And I'm just keeping an eye on time. I want to make sure that I give Doug plenty of time. So I'm going to run through some of these examples a little bit more quickly. But just, the question has come up of how are we feeding this back into the community? So this model that we're using in terms of the storytelling approach, and that we're having these informal events that engage the community. We capture their stories with people's permission, of course, analyze those, and then compare it to existing policy to identify gaps. And then we're transferring that information back to policymakers at the local and county level. And then hopefully we'll have another round of community events. And then the next example I'm going to share with you, and again, I'm going to go fast. I apologize in advance, but we're trying to work with different community organizations across various climate and public health issues. And the goal is to create positive systems change through community engaged work. So we're trying to co-design with partners a, a- an easier process and method for tracking community engaged activities and outcomes that work to promote public health systems change. And we're estimating or taking an educated guess at this point that a framework that we've previously developed will provide useful indicators that organizations can use to monitor and assess their progress and impacts of their community engaged work to advance public health. And so what that looks like, this is what we call the CASI framework. It's a community-led actions for sustained impact. And so we're working with our partners to see if all of these different factors across this model speak to or align with what community partners are experiencing when they talk about community engaged work. And then the last resource I'll share with you, we developed an extreme heat guide focused on health for schools that provides easy to share one pagers that cover the health impacts that people may experience within school environments. And this was a collaboration with BOCES as well as the Cornell Weill Medical School in New York City. Also, another community engaged activity that we are hosting in a couple of weeks is an immersive 3.5 day field training exercise focused on humanitarian aid and disaster response. It's too late for me to accept participants, but if you want to come and observe, or if you want to be a role player, we will gladly have you join us. And if you want to be made up with a wound, we have some experts that are providing that as well. And then we have a lot of resources. And since you all will receive the slides at a later date and time, I won't go over this. So with that, I will hand things over to Doug.
All right. Things got moved around. Are you seeing my slide presentation? Perfect. Okay. Um, so I think I hope you don't consider this a bait and switch. I know I had told Gay that I was going to be focusing on a lot of HABs, but when I started putting this together, I really thought it'd be remiss if I didn't just kind of step back and do more of a broad overview of a lot of the things that a lot of the different divisions and departments do in the whole county health department and some of the other county departments here. So just to kind of give an idea here, and I like to start with some numbers. We're not unique here in the Finger Lakes for sure, but we do have a couple, I think, interesting challenges. But we have about 105,000 residents in the county, but we have about 270,000 annual visitors. And so that creates some interesting dynamics there. And on top of that, we're a county that has two colleges and a university. So that brings in a whole different grouping of people throughout the year. Just for fun, it was supposed to be sunny. I was hoping when we did this, but we have about 155 annual days of sun or 2,100 hours throughout the year. The sad thing was I saw that Binghamton has 55. I knew it was cloudy, but to put a number to it is just makes it harder. But what I did find, which was fun, was that depending on what genre or definition you're looking at, there's anywhere from 50 to 80 songs that have to do with summer and summertime. So we clearly have a love of, the season, and it's not just summer, of course, but it's being outdoors. And so with that, climate change clearly isn't just a summer issue, but it's an intersection with public health. And becomes more prevalent in the warmer months. So we really just have to, recognize that and gear our responses and planning appropriately. So a lot of this stuff was great that I was kind of teed up to talk about these things. So thanks to everybody else. But as we saw, daytime highs have increased, number of hot days are increasing, and even the nighttime lows are not dipping down as much as they used to in the past. And so these have both physical and mental health impacts on people. And so that was one of the driving reasons why we recently rebranded at the health department to become Whole Health, because we wanted to make sure people understood that, we're looking after both physical and mental health, the whole person, along with, my division in particular with environmental health and the intersection of all those. Um, and so, because of this heat, like mentioned before, the whole health department and our Department of Emergency Response collaborate with a variety of facilities throughout the county to provide those cooling centers. We have a core number that are available, but then depending on the severity of the situation, we have others that we can call on that will open their doors depending on need. So some more extremes with drought. If you do live in the area, our last extreme drought was back in 2016, and it got pretty serious there for a while. One of our jobs in environmental health is regulation. We're a regulatory agency, and so we work very closely with the city of Ithaca and Cornell, who both have their own water treatment facilities, and they each provide drinking water to about 35,000 people each. And both Fall Creek and 6 Mile Creek, which provide water for Ithaca and Cornell, they had significantly reduced flows. And so one of the things that we were working with them was just, what are potential ways to reduce water usage and, create scenarios where if people did have interruptions in water flow, what were we, in potable water, what were we going to do? And since then, they and Bolton Point, which is another water purveyor in the county, we in county planning have been working very closely with them to be able to build interconnections between all three. So that way, whether it's just routine maintenance or in these extreme conditions, we hope that they can share water from one facility to another. So that way, times of interrupted service are decreased, so people have access to potable water at all times. Then, of course, on the far end of that, on the other end, we have these rain events that seem to be heavier rains, seem to be happening more often, and it doesn't necessarily need to turn into a flood or a widespread flood, but it certainly can be localized for individuals or even other water systems. So what we've done is we've kind of created this list of systems that a lot of voluntary, but also our understanding of where their water sources are. We know areas that are more prone to flooding, and especially flooding around the wellheads. So that way we can, if there are these rain events, and especially if we hear from people that even live in the area in the division, or we hear from the public, we know areas to contact to make sure that their wells haven't been flooded, and if they are, then we can work with them to make sure that that interruption in service is as short as possible. And one kind of win that we're working towards here is that for, I'd say about the last year, but it's probably been closer to a year and a half because time goes quickly, is we've been working with a lot of different agencies to push to get about $1.5 million in grant money to expand a public water access to a mobile home park, which is right now has 100 homes. It's permitted to have up to 150 in order to get public water to them, because right now their wells are currently in a flood zone. And so just really dangerous for those people and a lot of people, especially low income. And so as far as private individuals, we are certainly here always, even though we don't regulate private wells. If people do find that their well has been flooded, we're here to provide guidance. We can go out and do a site visit and give them guidance as to who to contact and the steps to follow to test their water and do any kind of remediation if the tests do come back, say, coliform or E. coli positive. As far as tick-borne illnesses and other things like that, our community health services, nurses do a lot of good work. Like Bryon was saying earlier, one of the things they do is stay in close contact with our state partners to see what the new trends are and any changes in the data. And even though because Lyme is so prevalent, they don't do any follow-up case reporting with that, but or investigations. But if there are other tick-borne diseases that pop up in the county, they'll do a follow-up investigation to see, what the situation was and the circumstances that led to it. And to do that, we have, of course, our website and we do social media, but we also try to get out in the public, or they do as much as possible. So they have about 50 tabling events a year where they hand out tick safety guidelines and brochures and pamphlets and tick removal tools and things like that. And so just trying to really get the message out. Now, we are fortunate we live in a county that does have a lot of hiking. A lot of people are very, very active outdoors. And so the few events I've been to already this year, people that have come up to our tables were already very aware of the changing dynamics in this. And so I think the message is really getting out there already, which is really good to see. Um, In Tompkins, we are very, very fortunate to have a nonprofit organization called the Community Science Institute to help us with these harmful algal blooms. They not only does the Community Science Institute, CSI, they have a branch where they do water testing for private individuals for potable water and public facilities, but they also have a very, very strong HAB outreach, and they recruit a lot of local people to be what they call HAB harriers to just keep an eye on portions of the lake. And if they see a bloom, they report it, and then they'll actually take a sample, send it to CSI. CSI will test it to verify whether it actually was a bloom, and if so, then to see if any toxins were present. So we do support them with monies to help that, because they also are able to communicate to us areas of blooms that might be around some of these public water systems that have wellheads really close to the lake. So that way we can work with them to make sure that those blooms may not be impacting the water they're providing the public. Last year, we had a total of 84 blooms just in the little portion of Cayuga Lake that Tompkins County touches, and the lake itself had a total reported to CSI as 284. So unfortunately, they've become more numerous over the last few years and more persistent. So there's no way I really list, and I feel remiss about that, but list everybody that we're working with to help with this. So I just wanted to highlight a couple of the things that we've been doing. To one, reduce the nutrient load into the lake. As a regulatory agency, we don't have a lot of control over a majority of the sources of nutrients, but what we can do is we went through the state. The state a few years ago offered this ability to create these drinking water source protection plans, and because we have three large water purveyors that have the two streams, the two creeks, and then the lake as sources of water, this kind of allowed us to work together to create these plans that identified both point and non-point sources of pollution. And so not only are we protecting source water for people to drink, but also the water that people are going to recreate in and be around, especially with these harmful algal blooms. So we're hoping to be able to, we've gotten some funding already to do some stream corridor assessments to see where these rain events are really affecting these streams the most, and where most of the erosion is occurring. And that way we can work closely, especially with Soil and Water Conservation District, to work with landowners and try to shore up those regions of the streams to reduce the movement of sediments and nutrients to the lake. I personally, here at the health department, am administering the state septic system replacement program, and this is a program that they put out for particular water bodies in the state that's we're going to benefit from reduced nutrient loading. And so this is a program that provides 50% up to $10,000 to homeowners replacing failed or failing sewage systems. And it used to be just on the lake, but they recently expanded it to go along Fall Creek and 6 Mile Creek as well, because they were sources of drinking water. And like Neil gave the shout out earlier, which I appreciate, and NYSECHO is very generous to work with us and provide us with that mini grant this year. So that way we could work very closely with not only CSI, but another stakeholder here, the Cayuga Lake Watershed Network, to create some shared branding materials or shared educational materials. So we're all giving the same message to people that come to the lake, and not necessarily just Tompkins, but the whole lake, because and so that way we're all saying the same thing. Visitors and residents are all getting the same message, and so we're developing those materials, and we're going to be able to expand our outreach this summer with tabling events and try to work with being able to give out even more materials for people to have access to for being able to recreate wisely and make good informed decisions. Um, as far as the future goes, our planning department is very, very active in recognizing that these things are coming, if not already here. So back in 2022, they developed a Tompkins County Resiliency and Recovery Plan, which provides a foundation for collaborative action throughout the county to reduce the risks associated with climate change. So just making a document that really lays that foundation for everybody to be able to have a shared conversation about uh, what actions can be taken. But then they're also working towards being able to update our 2021 hazard mitigation plan that is going to be able to, with the changes that we've even seen in the last few years, create a more current list of targeted mitigation actions that are specific to each municipality, because they are a little bit different throughout the county. So luckily, nice and short and sweet, but really what I wanted to kind of just bring to the front here is that, clearly climate change and its effects are complicated, and it covers a wide host of public health concerns. And so I just covered the bare surface of what a lot of our divisions and departments are doing. I wish I could have covered more. Um, but of course, like anything else, I know a lot of not just our county, but others with all the conversations we're having. They do a lot of good work, and street resources can be stretched thin with as complicated as this is. And one of the things I'm finding, even after an initial career in education, is that it's very challenging finding the right amount and type of information to provide. So that way we want them to be able to make informed decisions, and not only living here, but also, those 200 plus thousand visitors we have to recreate safely and enjoy the community and the county, but not to scare them off either with an overabundance of information, or we just want to make sure it's accessible. Um, and so, but with that being said, we are very fortunate that our community recognizes these challenges, and that there's a variety of needs because of these climate change challenges. So they're very supportive at many, many levels of the work that all of these groups are putting in. So that was all I had, and thank you for your time.
Thank you so much, Doug, and Neil and Brian and Danielle. Um, some of the questions have been already answered, but there are a couple tick-related questions that we can start with first. And I was wondering if you can get more than one disease from a tick bite. Do they carry multiple diseases? And have we ever tested? I've had Lyme twice. Um, when they test for Lyme, you've got Lyme. Do they look to see what else you might have gotten?
So there's a couple of different answers to that. One is we can definitely find ticks that have multiple pathogens. Um, it doesn't happen. Well, finding ticks with two pathogens in them happens often. Three or four can certainly happen, and I think every once in a while we get one that has, like five. Um, a person having multiple diseases from one tick bite is a little harder to pinpoint. I certainly have Lyme disease and anaplasmosis or babesiosis or any of these sort of in combination with one another. Whether or not they got it from one tick bite or whether or not they got it from multiple tick bites and just didn't realize that they were bitten at another time is a little bit harder to figure out. One of the challenges that we potentially have with providers sometimes is usually the default will be to test for Lyme, and if the Lyme comes back positive, they'll stop testing. And so one of the issues that you can potentially have there is that um, you may miss, or a provider may wind up missing another a second illness or whatnot, if they only choose to wind up testing for Lyme, sort of stop there. Um, there's some questions as to whether or not a disease is worse or better, so to speak. Whether the course is more difficult or easier if you're co-infected or not. It kind of probably depends on the diseases, and as with anything involving people, everybody reacts a little bit differently as well. So there's some stuff out there that said if you have Lyme and anaplasmosis at the same time, it may be worse. Some say the individual diseases may not necessarily be as worse. So it certainly is possible to be infected with multiple things.
Okay, good to know. The other tick-related question was from Reggie. What, if any, plans do you have for nope. Do medical practitioners receive this updated tick pathogen information that you've shown?
We send stuff out every year to providers. One of the things that the department does is mailing list, so to speak, of roughly 250,000 providers across the state that we will send stuff out to. As you might expect, um, you can't use that list all the time, right? I mean, you have to be kind of careful if you use it. You don't want it to turn into junk mail. So being able to reach out to providers and kind of give them information in ways that are digestible and usable and so forth is important, right? I mean, there are things that we work with other groups to do things for CME credits, things like that from time to time. But we definitely try and get information out. And at the beginning of every year, every tick season, we usually put out a, quote unquote, like perils of summer type of advisory that includes things like, ticks and mosquitoes. It includes foodborne illnesses from picnics and so forth. It includes heat related stuff. So, all these things sort of get included as just a reminder of, hey, we're coming into a season where uh, you can expect a lot of these things. And this is sort of, how you should test, how you should, look for them.
Thanks, Brian. And then we'll wrap up with just two questions that are more related to the heat waves, to extreme heat. Um, my question is that oftentimes we might be having a really bad heat wave with high humidity and violent storms that have knocked out the grid. So there's no cooling center to go to. Um, and that knowledge has prompted me to buy my sister and nieces who live in urban environments little solar chargers and solar powered fans, and solar lanterns, things that they could, get through it with the little at-home rescue packages in the closet that you could pull out. And I'm wondering, I know that we're paying for air conditioners to be put into, lower income homes where there's vulnerable population. Are we thinking about when the grid goes down? How are we helping people?
We are thinking about it. I think that's a tougher nut to crack. I don't know, Danielle, if you want to mention some of the discussions we've had with a group at Cornell is sort of how to thinking about these worst case scenarios, right? And we are talking about putting together an exercise that would help get state agencies, local partners thinking about those kinds of questions, because I think that that's going to be a big problem. We know we've learned from partners who lived through the Pacific heat dome out in the Northwest a few years ago that, if the power goes down or just you have these really extreme temperatures that it's sort of a different ball game than what we're used to. And I think like the power outage is a scenario sort of like that. I think having something where you could, use some sort of solar powered device to activate a cooling or provide cooling makes sense. We haven't put guidance on that out on that now. We've talked a little bit to partners in dishes about providing for like emergency cooling shelters, that sort of thing, the kind of thing that might be activated following a flooding event, a shelter. But this would be in that kind of situation that might have a generator powering some sort of cooling. I think it's a great question, and probably there's still some work to be done there.
Yeah, I was imagining even being able to put together kits at bulk pricing that people could invest in,
Mhm.
yeah, to have on hand. The other related question, again from Reggie, what if any plans you have for providing transportation to cooling centers for those who need it? Is that anything, Doug, we've talked about at the county level?
I don't know specifically about that particular instance, but we do have a county-wide number. I believe it's 211 that people, if they don't have transportation and even just, standard typical circumstances are able to do. It's like a kind of like a ride share opportunity. So I presume that would be available in those circumstances as well.
Hmm. Something to try to make sure everybody knows is available if they
Mhm.
are too old to drive and they're in a heat wave, and the power's out. Um, we've gone over time, but I think it was worth it, in my opinion, to hear from all of you. I just want to really thank every one of our panelists today and the folks that are still with us online, um, for joining us for this Finger Lakes Forecast webinar. I hope everybody will stay engaged in this topic and help guide our decision makers. Working together, we can get the greatest overall benefit for our community. Um, if you'd like to support Sustainable Finger Lakes and the programs like our this webinar series, you can visit our website's donation page at sustainablefingerlakes.org. Um, Lastly, we hope to see you on June 10th for the next Finger Lakes Forecast webinar on future-proofing our grid in a time of extreme weather and mushrooming demand, especially from the AI data centers. I'm hoping to be able to pull together a good panel on that topic. It seems very timely to me with um, our summer storms coming along, as well as these questions of just how many gigawatts of data centers are we going to add to our grid? And how does that grid work anyway? And who makes the decisions? Those are the things I'd like to explore, and so that all of us are knowledge carriers when it comes to helping make policy to guide our shared future. So I just want to thank all the panelists again. Thanks to all of our attendees for joining us today. I appreciate all of the work that you put into it and the questions from the audience. And we will be getting out to you another email for the registrants with the recording and the slide decks and some links to resources that you can then have on hand on this topic area. So thanks again, everyone, and enjoy the rest of your day. I think it stopped raining and there's a little bit of blue sky out there to enjoy. So take care, everyone, and we'll hopefully see you in June. Bye bye.